Hello everyone, Wayne Tucker here. In this video I want to talk about my primary care experience. I was responsible for the primary care program at the North End Community Health Center for 2 years. We're responsible for the day-to-day activities of the clinic. This clinic that I was responsible for had a total of about 28 staff that involved the support staff, clinical aid position, the nurse practitioners, the nurses, the physicians, the locums, as well as dietitian, social worker. So responsible for the day-to-day activities of the clinic. A number of things responsibilities included was also the EMR. So I was responsible for day-to-day ensuring that the EMR was up and running for the professional staff and the support staff to use. And any problems that occurred throughout the day, I was in contact with our EMR to get those issues resolved as quick as possible, because it would create problems for our clinic in terms of getting our work done if we couldn't access the EMR. I was also responsible for patient complaints. So if there was any of our patients had any issues with any of the support staff or clinical staff and wanted to talk to someone about their complaint or even file an official complaint, I would be the person taking that call or that person walking in to talk to them and hopefully address their concern and their issue. Another area that I was responsible for was clinic scheduling. So I managed the clinic schedule for all support staff as well as all the clinic staff, professional staff. So to start, when I started in the position, there was a number of people involved with the scheduling process, so it was actually very convoluted and resulted in a number of errors occurring on a day-to-day basis. So I took steps to change that system, to centralize it to just mainly myself involved with the scheduling, and I changed it as well as to take it away from a paper-based system to electronic way of tracking the scheduling and entering all the information. So I did that through a tool that we had researched called TrackSmart and implemented that. And staff could access that software when they were away from their office and check on their schedule when they were supposed to be coming in. And I kept it, put a lot of work in to keep it very current, and so that because I didn't want any mistakes to be occurring for obvious reasons that has serious implications for the clinic if a physician is scheduled to be there, but it's not in the schedule, so we don't know to book the patient. So I had to make sure that the scheduling was in this new tool, TrackSmart, was very accurate. So I was also involved with privacy at the clinic, so dealing with a number of privacy breaches, ensuring that they were taken care of and appropriate notifications were made, and ensure the appropriate steps were taken to resolve that privacy breach and ensure that it didn't happen in the future. So I'm going to talk about privacy in a little bit more detail in terms of my role and what I was doing during those privacy breaches in another video. Also responsible for all the hiring of the professional staff and support staff. So I did that on a required basis when we needed additional staff. So that was hiring new locums, physicians, nurses, as well as nurse practitioners, any support staff, as well as the clinical aid. So it involved ensuring that we had all the professional staff and support staff that we needed for the clinics. Another component of the position was we took on, we had some serious wait time issues at the clinic. Wait times were very long to see many of the physicians, and some physicians had a very much longer wait time. So we set up a committee to address the wait time and did a number of things during that committee, that work. So we first had to set up kind of a standard of what we thought would be acceptable, but that was just kind of a starting point, because some of the wait times to see some of the physicians were 6 weeks, 7 weeks, and even up to 13 weeks. So even though we wanted to get down to 2 weeks, we initially started with about, I think it was 4 weeks, to get it down to that point, and then resolve it to work on it further after that point. So we would meet on a regular basis. I think it was about once a month, to talk about wait times and the way to address it and to implement those changes at the clinic. So that was another aspect of the position. Another component was ensuring that the clinic had all the supplies and the medical equipment it needed to run. So I had support staff to help me in that role, with that responsibility, but you had to ensure that those funds, we had the money in the budget for those funds to purchase everything that we would need for the clinic. On occasion, there would be a need to, if we had any issues with any patients, or like sometimes it was it wasn't often, but occasionally we did police would need to be involved with some patients that were being disruptive to our clinic, so they would be called to help us resolve those issues. I was the main contact with working with our external IT provider to ensure that the server was up and running, and that any other problems with our computers were addressed. So I would be working with our external IT provider to make sure that the clinic was up and running, and that regular maintenance was done at the clinic on a regular basis. So the position was very diversified. There was many different roles that you had to play throughout the day. Another one I want to mention, which I did a separate video on, that I was involved with the capital project of creating a new clinic. It was involved renovating 2 floors of a building that was not too far from our old site, and renovating one top floor was for the dental clinic, and the bottom floor, and top floor for the dental clinic and the primary care clinic, and the bottom floor for other programs, for example, including MOS. So the position was very exciting. It was very busy throughout the day, and provided a great opportunity for me to apply my leadership and management skills in the position. Okay, thank you very much.